What is regenerative medicine? Well, most medicine's designed to manage symptoms, but regenerative medicine is designed to change the underlying biology. It's not a marketing line, it's a mechanistic distinction. And the FDA actually has an accelerated regenerative medicine track. So they want regenerative medicine to come into the world of the United States. But there's some challenges, and we're going to talk about that. But we're going to also talk about some of the new breakthroughs, because this field has moved more in the last 5 years than I've seen in the last 15 years. And most clinics are still presenting it as it's just a single product, but I can tell you there's so much more to the world of regenerative medicine. And I hope to share some very interesting insights with you. I'm Regan Archibald. For those of you who haven't met, we're now friends. I'm the founder of Ageless Future, and we're a world leader in longevity medicine. We want to help people look, feel, and perform their best at any age. And so what I'm about to show you is what most clinics seem to miss. But regenerative medicine, what it is it's not like some one thing, one-time intervention. It doesn't mean like you can still, eat your fast food and sit on the couch and drool on yourself and still get results. Regenerative medicine means you've got to build lifestyles in that's going to enhance your body's regenerative capabilities. And it also means that there may be multiple inputs. And it's not just, the world of stem cells or peptides. It's actually a whole combination of things that is selective to your biology and very precise based on what your labs look like. This common principle that is underlying it is, instead of blocking a symptom, regenerative medicine restores your biological processes. And it drives tissue regeneration, it reverses disease, it helps subvert aging. So, we can age later. I just prefer to age when I'm old. There's different things we can look at. You can look at different biologics like PRP. Many of you know platelet-rich plasma. This comes from your own blood. Many people in the regenerative medicine world, and this falls into the category of bone marrow aspirate concentrate. And this is where you pull bone marrow out of your bones, and there's some stem cells in there, and that's, or a lot of these allogenic cell therapies. You can get it from your adipose tissue, from your fat, and that helps with some of these properties. And then probably our favorite place, and the place where we focused on the most, just because we found better results and more predictable outcomes, is these mesenchymal stem cells from umbilical cord or perinatal tissues. And this is a really exciting place of regenerative medicine because MSCs, or mesenchymal stem cells, Arnold Kaplan was the first researcher to identify these types of cells that could help us regenerate, damage to the ligaments and the tendons and the muscles. But he changed the name a few years later to medicinal signaling cell. And so he found that these cells are just sending signals. And I look at the medicine of the future, and especially regenerative medicine, as being able to tune up the body's signaling properties so you have better communication between cells. One thing that's been noted in there's regenerative cells themselves is there's peptide therapies. Regenerative medicine, if you find this vial of MSC or a vial of stem cells from the umbilical cord tissue, you'll find that there's these naturally occurring peptides, and there's 261 different types of peptides that have been identified, but some peptides are going to balance this IGF-1 axis, so they're going to turn on some of the receptors for growth hormone. You're going to see this VEGF activation. You're going to see this lowering of systemic inflammation. And then once you do that, now you can turn on the signals for better cartilage and bone health. And even in some of these MSCs and in these umbilical cord tissues, you'll find these very specific cells called Muse cells. Now, if you have never heard of Muse cells, we've got a video called What Are Muse Cell Treatments? A lot of the research has happened in Japan since 2010. These Muse cells are all in clinical trials, but they're naturally occurring in your body. And so the way that we look at it is we say, what are the ways that we can apply the smallest amount of input that yields the highest amount of regeneration without risking tumors or teratomas, anything like that. And Muse cells seem to have this biological operating system that allows us to turn on the right enzymes. They lower inflammatory cytokines, and they can change the gene expression. And Muse cells are very fascinating because they survive harsh environments. So what the researchers, Dr. Mari Dazawa, what she noticed is she said in a hypoxic environment where there's high levels of stress, all the MSCs die. And so once again, MSCs are part of the regenerative medicine that we're talking about, but she says there's one cell type that emerges and that can survive very harsh environments, and these are Muse cells. And so as she and her research team has started to isolate those, now there's clinical trials. I believe there's approvals in Japan at least for strokes. And so there's some very interesting things. But if you think about, these Muse cells, you run the risk anytime you've got regenerative medicine where you're turning on cell signaling to the point where cells start to replicate, there can be danger ahead. And that danger ahead could mean that these cells form a tumor or a teratoma. But Muse cells, interestingly enough, they don't have the same gene expression that would cause the cell to replicate cancerous cells in your body. And so they're looking at it even for treatments of cancer. But once again, that's far into the future. So one of the tests you'd want to do before you jump into regenerative medicine is make sure you get your blood labs ran, you're looking at your platelets, your C-reactive protein, your homocysteine levels, all your cardiovascular markers, and then your immune markers. This is really important because some regenerative medicine, if your immune system's not adaptive, you may have kind of like this flu-like symptoms after you've had regenerative medicine. And so by looking at your immune markers, remodulating the immune response, you can know what you're up against. Usually a little bit of Benadryl or an antihistamine can reduce those symptoms. But the interesting thing is when you think about stem cell therapy and research, Dr. Yamanaka, another Japanese researcher out of Kyoto, he discovered what are called Yamanaka's clocks. And he found, and Dr. David Sinclair is doing some very interesting work on this, where they're using 2 of, I think, the 6 Yamanaka's clocks in mice, and they're able to restore blindness, and they're getting ready to move to human clinical trials, which is really exciting. But with Yamanaka's clock, you can take an old aged cell and change the genetic expression of that cell and take it to its youthful primordial state. My goal is to die at a very old age in a young body and to die fast. Most people are living as young humans in a very old biological body. You're 30 and you've already got these aches and pains, and you've got chronic disease. So we're trying to prevent that, and I think regenerative medicine is where we'll see it. But the problem is when you turn on those genes, now you have problems with teratomas and tumors. And even with the Yamanaka's clocks, there has to be a buffer agent with those cells so that they're not continually replicating. And so with MSCs, some of these findings, you'll find that the mesenchymal stem cells found in umbilical cords, they're turning off this NF-kappa beta. They're lowering some of the other inflammatory markers like IL-6, tumor necrosis factor alpha. We're finding that they help turn on this anti-inflammatory cascade in chronic joint disease. They found that stopping the cartilage breakdown, this is something that we've seen in many cases. You can upregulate the type 2 collagen. You downregulate some of the proteins that damage the joint like MMP13. So it's very exciting to see because there's this thing called anabolism and catabolism. And so with regenerative medicine, once the body's degenerating, it stays in that cycle. And so what researchers and clinicians, what we're trying to do is to allow your body to regrow at a certain pace, not too fast, so it does take time for these therapies to kick in, but we're also trying to break down and remove that kind of aging process where we're in this catabolic state where our body is basically degenerating. And so it's this beautiful balance that's being struck, and I think in the future regenerative medicine will be mainstream medicine along with peptide therapy, Muse cells, and these are things I'm all very excited about. If you're someone who's excited about it, I appreciate you being here on this channel. We have another video on BPC 157, which does have some very interesting regenerative properties. We'll provide a link in the show notes. I'm Regan Archibald. I'll see you in the next video.